Hello, how's it going today?
Hi, I'm okay. How are you?
I'm doing well. I'm glad you're here. Well, my name's Tim. I'm a psychiatric nurse practitioner student from the University of North Dakota, and I'm going to be completing your psychiatric interview today. Okay.
Okay.
Is it okay if I call you Victoria?
hmm
Okay. Um, So a couple of things before we start here, okay? So everything you say here is confidential, okay? I'm not gonna go talk to anybody else or tell anybody else, but there is a couple exceptions to that, okay? So the main exception is if I think you're gonna hurt somebody else, okay? I would have to warn them and let them know, okay? And then if I hear about any elder or child abuse, I would have to report that as well. Do you have any questions on those items?
No.
Okay. So kind of how the interview will work is I'll kind of start to understand what's going on for you, I hope. We'll go over some medical history things, and then at the very end, we'll talk about a plan together. Does that sound okay?
hmm
Okay. Well, why don't you tell me a little bit about what's been going on the last 2 weeks? What brought you here?
Well, um, wow, everything. Um, my husband and kids are worried about me. My boss is worried about me. I'm worried about me. I'm worried about everything.
Okay.
Um, yeah. I just have a lot of worries and it's affecting everything.
Yeah. Um, and when did all these worries start?
Hmm. Well, they started about a year ago. Um, they've been getting increasingly worse,
Okay.
though. Yeah,
Okay.
like over the past month have been pretty bad.
Okay. And nothing happened within the last month, you think, to really make them worse, or?
No, everything's pretty much the same except for my boss telling me that I might need to cut down my hours because I've been so irritable at work. That's the
Okay.
only thing that's really changed, but work hasn't really changed.
So what I'm hearing you say is it's maybe starting, your worrying starting to impact your life and your work a little bit.
Yes, that would be accurate.
Okay. Could you tell me a little bit more about that?
Well, um, I used to cook and go to my kids, stuff, their dance and football. Now I don't really go anywhere, even
Okay.
with my friends. I used to go to church and I don't do that anymore. Um, and then I told you about work.
Yep.
Yeah.
Okay. Well, thank you for sharing that. I appreciate it. I know it's not easy. So you said about a month ago that all this started, right?
Mhm.
When is the last time you remember feeling well?
Over a year ago.
Okay. Okay. And no event that you can really think of that changed a year ago. Things just got more stressful for you and things started impacting your life and you kind of have these generalized feelings of worry, it sounds like.
Yeah, nothing really changed big. No.
Okay. Can you tell me a little bit about how this has impacted your family?
Um, Well, I mean, my husband's worried about me. Like I said, my kids don't really know what's happening specifically, but they know something is wrong.
Okay.
Um, and my husband wanted me to come in today. I just haven't been active in my family or s- been spending time with them.
Okay. Sounds really hard. Well, I'm here to help, okay?
Thanks.
Would you consider yourself a worrier?
Yes, that's me.
Okay. A lot of people. And it sounds like I'm not hearing anything in particular that you're worrying about, or am I wrong?
Well, I mean, I worry about people, like something happening to my kids or my husband. Um, there's not like a specific like thing that I'm worried about happening. Just them. in
Yeah.
general. Yeah.
Sounds like you're a very empathetic and caring person, and sometimes this gets to be a lot.
Yeah, it definitely gets to be a lot. I try to care about everybody, but like I said, it's just hard when you're not sleeping, well, or to do anything, and then you're just anxious and irritable. You know, you want to help, but if yeah, I just can't.
Yeah. Tell me a little bit about your sleep. So you're saying you're not sleeping well.
Mm-mm.
What's going on there?
Well, I mean, it's not like I don't try. I go to sleep and then I wake up 2 or 3 times a night, and then I can't get back to sleep very easily. And then if I do, I'm waking up like hours later because I didn't, fall asleep fast enough. So I'm oversleeping. Yeah, it's been pretty consistent too.
Okay. How many hours a night do you think you're getting?
Broken up about 5, maybe,
Okay. And what do you think you need to function well?
at least 8.
Okay. So you're definitely one of those people like myself that really needs their sleep.
Oh yeah, definitely. I'd be covering up the bags with the makeup right now. So,
Hmm, well, hang in there. What about like muscle tension? Any feelings of kind of like a stiff neck, anything like that?
no,
Okay.
no, I'm pretty good physically, except for just feeling tired, obviously. But yeah.
And then you said you were having a little bit of difficulty concentrating. Is that right?
Yeah, like I just because I'm worrying about everything. So all these thoughts are running through my head and I just can't, you know, remember what I'm supposed to do next sometimes.
Okay.
Yeah, at work or you know, at home with schedules and stuff.
Yeah, you've got a lot going on, and then on top of it, you're not sleeping, so that doesn't help. Okay. Do you think that you've been restless at all?
Yeah, I would say yeah, definitely restless. I mean, it's weird because I'm tired, but I just feel like fidgety,
Okay.
and yeah.
Kind of like you have ants in your pants, kind of, or
Yeah, yeah, absolutely. It's hard to explain, but um, yeah, I mean, it's when you're tired, but you still can't sit still.
yeah. No, I can definitely appreciate how that would be hard.
Mhm.
So sometimes when people feel the way you feel, they describe almost what we call like a panic attack. So their body gets really, really revved up, their chest gets tight, they feel like it's going to burst out, and their heart's going to burst out of their chest. They have all these really physical symptoms. Do you think you've had anything like that?
No, I don't I don't get physically worked up. Like my heart doesn't start to race or anything like that.
Okay. So no panic attacks, you don't think anyway.
I don't think so. No.
Okay. What about social situations? Do they make you uncomfortable?
Mm, Not usually. I haven't been out much lately, but
Yeah, that's what you're
um
saying.
yeah. But no, not usually. I'm usually okay like at parties and stuff, if that's what you mean.
So you don't worry about like leaving your house or anything like that, or you get particularly anxious before you go somewhere when you do go somewhere.
No.
Excuse
No.
me.
Mhm.
Um, what about any special fears, such as like insects or flying or anything like that?
No. I generally do okay squashing the bugs and stuff.
You're better than me then. You're braver than me. Good for you. You're the slayer of spiders at your house.
I am. That is one of my many jobs.
What about any symptoms of like what we call OCD? So needing to wash your hands all the time because you just feel dirty and you just can't get them clean, or checking things over and over again. Anything like that?
No. I don't have anything like that.
Okay. What about any trauma history, any abuse as a child? I know that's a tricky subject to kind of blurt out and ask about, but a lot of times these things impact our mental health and they're really important for me to know about.
Mhm.
Can you think of any trauma that you've had?
No, I had a really, really pretty good childhood. I My parents were great.
Good, I'm glad. Are they still around to support you?
They're not, unfortunately. They passed away a few years ago, but I have my husband still, so.
What about any symptoms of PTSD, such as like really painful memories, any flashbacks, avoiding things that you may be scared of, anything like that?
No, I don't have anything like that. I don't think it's more like just nothing specific, It's not like I can pinpoint anything down, just worry about my kids and stuff.
Yeah, no, that makes perfect sense. Um, all right, so I'm just going to ask you a few different questions, okay? And then, if you don't mind thinking about the last 2 weeks, how often these things have been happening to you. So, a little bit, kind of in the middle, or a lot, okay?
Mhm.
So, you mentioned that you've been feeling kind of nervous on the edge. How often do you think that's been bothering you in the last 2 weeks?
A lot,
Okay. What about not being able to stop or control your worry?
a lot.
Okay. Sorry. Well, we're here to help, okay?
Mm,
Worrying about too much about different things.
a lot.
Um, what about being so restless that it's hard to sit still?
Yeah, the ants in your pants, like you said.
Yeah. Are you able to sit still when you
I
try?
mean, most of the time, but not all of the time.
Okay. And you said you've been irritable, right? Are you able to control your irritability when something bugs you?
Not not recently, no. The last 2 weeks, no.
Okay. And how often, using kind of that scale we were talking about, are you finding yourself easily irritable?
Like almost always.
Okay. So on a typical day, how often is that happening?
Well, if I'm at work multiple times at work, 2 or 3 times at work in different situations probably, and then at home, I mean, when I get home with the kids and the husband, a couple more times.
Okay. Thank you. I know it's not easy to talk about some of this stuff.
No, it's okay.
How often have you felt afraid or like something awful is going to happen?
Mm, what were the scales again? Like every day or
Yep. So in the last 2 weeks, how often have they happened to you? Kind of that little bit, that moderate amount, or kind of all the time?
mm, all the time?
All right. Well, we definitely have things that we can do to help. Okay. Um, what about, this is kind of a weird question just to jump into. Any thoughts of self harm, cutting, burning, anything like that?
No, I've never had any of those thoughts.
Okay. And do you know where you would go or what you would do if for some reason you did have those thoughts?
My husband.
Okay. And you feel like you could talk to him about that?
Hmm. Yes.
What about any thoughts to hurt anybody else?
No. I mean, I have teenagers, so, but
Oh, no. Yeah, teenagers can be unpredictable,
mhm.
shall we say?
Yeah. No, no. I'm just kidding, but no, no, not at all.
Okay. So to switch gears a little bit here, we have so many parts of our life that impact our mental health. So I'm going to ask a little bit about kind of your social history, okay?
Mhm.
So tell me a little bit about, you said your parents were great. Can you tell me a little bit about what your upbringing was like? Did you go to college? Do you have siblings? Those sorts of things?
Sure. I grew up in Southern California. My mom was a teacher and my dad was a social worker. And they were big civil rights activists. I grew up doing all kinds of activities with like farm workers.
Cool.
Yeah, really socially active family, very supportive. Um, and the, I went to college and the first time around got my degree in psychology and then nursing after that. I have two siblings, one of which has died. She died of a drug overdose. She was bipolar. Um, yeah, it was a while ago. It was more than 12 years ago. Um, and then I have another sister who is a college counselor. And yeah.
So it sounds like going back to when you were a little tyke, you had parents that cared a lot about a lot of wonderful issues, and maybe that's where you get a lot of your caring
Yeah, I
attributes.
hope so. I hope so.
Otherwise, you wouldn't have become a nurse, right?
Yeah.
Um, what about substance use? What kind of drugs do you use? And then how often do you drink?
Uh, I don't use any drugs. I do drink alcohol, probably just when I go out to eat,
Okay.
which isn't very often. Um, so like we go out like once a month to eat.
Okay. And then how many glasses of wine do you have at dinner?
Um, Probably it's with Mexican food, so it's probably Corona, and it's probably just one, maybe
Okay.
two if I'm pushing it.
Oh, sounds good though. I bet you had really good food in Southern
Oh
California.
yeah, I miss it, but there's good food here too.
Yeah. Um, thank you for explaining that. What about caffeine use? Do you drink a lot of coffee? Do you drink those energy drink things? A lot of those are the rage right now.
Um, I don't drink energy drinks. I drink coffee, but just in the morning before work. I mean, not throughout the day or anything. I'm already kind of, amped up anyway. So,
Yeah, especially with your sleep. I would just be really careful about that. Avoid any caffeine after 7 o'clock or any of those sorts of things, kind of those sleep hygiene pieces. So that
mhm.
might help just a little bit, okay?
Yeah, that's a good point. Yeah.
Um, what about your support network? So it sounds like your husband, you mentioned you're not hanging out with your friends as much. What did you used to do with your friends? Who did you consider your support network?
My friends are, mostly coworkers. We go for walks and things, and normal friend stuff. Go out to have coffee on the weekends, although I would do decaf then. Um, yeah, I can't seem to drink coffee after 10 o'clock in the morning. But yeah, I mean, but I haven't been doing any of that lately.
Okay.
So yeah, and my support system is my sister and my husband, my kids to some extent. It's hard with kids. I mean, you don't want to put too much on them. But
Yeah, but they're there for you. They're there to listen.
mhm.
Okay. So kind of on that note about your immediate family, have any blood relatives suffered from any psychiatric conditions that you're aware of? Any nervousness, depression, mania, psychosis, schizophrenia, alcohol, drug abuse, suicide attempts, or any hospitalizations for mental health?
My sister was bipolar.
Yep, sorry.
Oh, that's okay. A lot of information. Um, but my other sister knew nothing like that. And my mom, I think she might have had a bout of depression, but I don't think it was something that she did, was something that was bothering her for a long period of time.
Okay,
My dad, I don't think so.
okay. And then physically, like, overall, do you feel healthy?
Yeah,
Okay. What about any health problems?
nope, I don't think so.
Okay. So I just usually kind of go from head to toe a little bit to kind of sometimes it jogs people's memory about some medical issues. Okay. What about headaches or seizures or head injuries?
Nope.
Any vision, hearing problems?
Mm-mm.
Any smelling problems or with your sense of smell or taste?
No.
Okay. What about problems with your thyroid?
No, it was tested a while back. I can't exactly remember when, but it it was fine then.
Okay. It might be something we need to look into just because thyroid levels can impact anxiety. Okay. So maybe if you can send me some lab results that you do have, that would be great. And we can kind of take a look at that.
Sure.
Cool. What about any problems with your lungs? Any pneumonia, coughing?
No.
Okay. Any heart problems, stomach problems?
Mm-mm.
Okay. Any problems with urination, joint problems, any problems walking, anything like that?
No.
Okay. Um, any major medical issues with any blood relatives?
Mm, my dad was diabetic. That's pretty much it.
Okay. And then you didn't mention any current medications. Are there any medications that you're on right now?
No, just like a woman's prenatal because of the iron,
Okay.
stuff, and I take like ibuprofen every now and again.
Okay. And what do you take the ibuprofen for?
Oh, just if work's particularly hard and my legs hurt from being on my feet all day or something like that, or my back hurts, but I don't have any like injuries from work or anything, just regular old people aches and pains.
You're not old because that would make me old too. So no surgical history or any significant illnesses in the past.
No.
Okay. And no drug allergies.
Nope.
Okay. And you mentioned that you had your thyroid checked a while ago. Who are your current caregivers then?
They're at Sanford. I think I see Dr. Calamati like once every 6 months or so.
Okay. And would it be okay if I got some records from him
Sure.
or her? I'm sorry, I shouldn't have assumed, but
Oh, that's okay.
okay. All right. Thank you. I appreciate that. What about a past history of any psychiatric hospitalizations?
No. Mm-mm.
Okay.
I've
Have you
never
ever
been in the hospital except for my kids being born.
Sorry to interrupt there.
Oh, that's okay.
What about any psychotherapy?
Nope. This is the first time.
Okay. Well, we're here to help. There's a lot of wonderful things that we can do together, okay? So I'd like to switch gears just a little bit here, and I just have some psychiatric symptoms that I just kind of want to discuss quick with you, okay?
Okay.
Do you think that you're depressed at all?
Mm, no, I mean, not always happy, but I wouldn't say I'm depressed.
Okay. If you had to pick a word to describe your mood, what would you say it is?
Mm, worried?
Worried. Okay. That worrier piece as you used to describe yourself. Okay. Um, in the past week or so, do you think you felt so happy and energetic that you weren't able to sleep, or that your friends told you maybe you were talking too much?
No, I don't think so.
Okay. Given how stressed you've been, do you think your mind has ever played tricks on you? Like you've heard voices, or people are putting thoughts into your mind or out to get you, or anything like that?
No.
Okay. Do you tend to worry about your health at all?
Hmm. I suppose it's part of it, not generally a major part of my worry, but occasionally.
Okay. And what is it about your health that you worry about when you are worrying about it?
Just that I won't be able to take care of my kids. I don't think there's a specific health issue that I'm concerned about.
Okay. And have you ever been treated for an eating disorder like anorexia or bulimia or anything like that?
Nope.
Okay. Then we're going to switch gears a little bit again.
Okay.
So it's maybe just some quick, what we just call cognitive testing to make sure that you're okay. I want to make sure you're all right because I care about you. So I'm going to ask you to remember 3 different objects and repeat them after me, okay? And then in a little bit, I'll ask you what they were.
Okay.
Sound good?
Mhm.
So ball,
Okay.
couch, and sofa.
Did you say pouch or couch?
Couch. So
Couch.
kind of similar
Ball.
there.
Ball, couch, and sofa. Okay.
Correct. All right. So how has your attention been recently? Do you find yourself getting easily distracted from conversations or anything like that?
Mm, I don't think so.
Okay. If I were to point to an object, would you be able to tell me what this is?
Mechanical pencil.
Yes. And if I were to point to this, what would this be?
An index card.
Perfect. Awesome. Have you noticed any personality changes or anything like that recently?
No, I'm the same person, I think.
Okay. And when you were in school, mostly elementary school and middle school, did you ever have teachers say that you were rambunctious or you couldn't sit still or you had ants in your pants or you couldn't pay attention?
No, I think I was pretty well behaved.
Okay. We all think that, don't we? I'm sure you were, though. I'm sure you're better than me. What were those three objects again?
Ball, couch, and sofa.
Perfect. Thank you very much.
Hmm.
And then just kind of some questions about today. What's the date today?
May 12th.
Perfect. And who's president?
Trump.
Perfect. And can you tell me who was president before Trump?
Ooh.
I know, something I don't think about very often.
Can I tell you who was president before Trump? Uh, Obama. Wow. Sorry.
No, you're fine. I kind of caught you off guard there. No worries. And can you tell me who Abraham Lincoln was?
He's one of our first presidents.
Okay.
Freed slaves.
What's that?
Didn't he? He was the one that freed the slaves, wasn't he?
Right. Yes. Yes. I thought you said he had slaves. I was like, oh, I did not know that.
Oh,
Okay.
well, I don't know. Maybe he did.
Yeah, I hope not. All right. So I have just two quick categories here, and I want you to list everything in that category you can think of just really quick. Animals.
Like list off some animals?
Yeah.
Oh, okay. Bear, tiger, bird. That good?
That's great. No, that's fine. And then what about towns? Can you list some towns for me?
Um, like cities, like San Francisco. I mean, it's not really a town. San Francisco, LA.
Yeah, perfect.
Houston. Okay.
Awesome. And can you tell me your current address?
1234 Mockingbird Lane.
All right. I like it. Mockingbird Lane. That's pretty. And where did you get married?
At Usher's in Moorhead. It's like a little kind of like a pub, but it had like a all glass room in the back. It was really pretty.
Okay. How did you end up in Moorhead?
Nursing, moved for the job, stayed here. Yeah.
Okay. Because I grew up in Rochester, so not too far from Moorhead. So.
Yeah.
Can you tell me what 2 times 48 is?
No.
I know, me either half the time, right?
It's like 8 and 8 is 6, 96.
Perfect. And then one silly question. If you were to find a stamped envelope and it was addressed and you found it on the ground in a parking lot, what do you think you'd do with that?
Nail it.
Perfect. That's awesome. So at this point, I've gotten to know a lot about you, and I really very much appreciate that. And it sounds like you're going through a lot of really tough things. And I think what's going on right now, and please, I'd like your feedback. Sounds like maybe you have generalized anxiety disorder, where you have a whole bunch of different things that you're worrying about all the time, and it's starting to impact your life. What do you think?
Yeah, I'd say that's pretty accurate.
Okay. How does it feel to hear that?
It's not surprising.
Okay. Well, there's a whole bunch of wonderful research-driven treatments for it. A lot of times we like to start with what we call cognitive behavioral therapy, okay, to kind of help your brain kind of reorganize its thinking in certain ways, okay? What do you think about that? How does therapy sound to you?
Well, if I can change the way that I think about worrying about everything, I'm all for it.
Okay. And how do you think your husband will feel about therapy?
He's pretty supportive of anything that's going to get me better. So.
Okay. Any barriers to starting therapy that you could think of?
Mm, I mean, maybe just actually getting to my appointments because I'm not really, I'm maybe not in the morning, so I
Okay.
can make sure I don't oversleep.
Yeah, no, I'm not a morning person either. I'd rather stay up late at night.
Yeah.
Well, I have a couple referrals for you as far as some options for psychotherapy, and I'd like to maybe discuss those together. I know a lot of these people personally, and they're really great clinicians, and we can kind of talk about together what you would be looking for in a clinician. Does that sound okay?
Hmm.
And we'll try and find one that just has availability in the afternoon.
Yeah. Yeah, perfect. Perfect. Because I don't want to miss them, but I don't think I can get up that early right now.
Okay. I totally understand that. And then, so we'd like to try that. If you're agreeable to that, it sounds like you are. And then if for some reason things get worse or we need to look at other options, there are medications that we can use. But I think it's a good idea to see how therapy works first. How do you feel about that?
Yeah. I mean, I haven't really needed medications up until now, so I've been doing okay.
Okay. And obviously, if that changes, you just give me a call. Obviously, I want you to stay safe. So if you have any thoughts to hurt yourself or anything like that, I want you to go to the ED, okay? But if anything else comes up, I'm always here too. Does
Okay,
that make
thanks.
sense?
Yeah.
Um, so at this point, I think I'll meet with you next week. I'll have a list of referrals for you. I'd like you maybe just to go home and talk to your husband kind of about what we're thinking about for your plan, okay? And then we can kind of talk about who might best be able to best help you. Does that sound okay?
That sounds great.
Okay. At this point, is there anything that I've missed talking about that you think is important to talk about?
No, I think we covered a lot.
Okay, I do too. It was really wonderful to meet you.
Me too.
Um, So you just let me know if you need anything in the next week or so, and we'll kind of make that our plan for right now. All right.
Okay, that sounds like a plan.
All right. Well, thank you, Victoria. I appreciate your time. We'll see you soon.
Yeah, thank you, Tim.